segment is sponsored by Orthopaedic Associates of Muskegon. We're talking lower back pain today with Dr. John Hawkins. He is the newest physician to join the team at Orthopaedic Associates of Muskegon. What attracted you to the Lakeshore?
First of all, Lakeshore is beautiful, and it's a nice change from the east side of the state. But Orthopaedic Associates of Muskegon is just a really great group of people. I think first of all, it's 18 doctors. We have a nurse practitioner. We have several PAs, several nurses, and we have a great support staff that makes taking care of patients easy and good. And I could see that just from my first couple of visits that they really do a great job taking care of people.
Your areas of specialty, physical and sports medicine.
Yep, so I did my initial training in physical medicine and rehab, and then I did some specialization in electrodiagnostic medicine, interventional procedures for pain, and then sports medicine.
We're talking lower back pain today.
Mm-hmm.
In my mind, one of the most agonizing kinds of pain to live with, really impacts your quality of life. Talk a little bit about that, what you see people presenting with when they come in like that.
Yeah, so I see a lot of back pain. I see it's tough and it's debilitating, and everybody has it. It's just running rampant, and there are things that we can do about it, but it comes in a lot of different shapes and sizes and from a lot of different sources.
Yeah, the diagnosis of the cause of the pain is critical and yet challenging.
Yeah, so I kind of describe it as a spectrum of treatment that we have available for treating pain, and there is a lot, and there's a lot of options, and there's not a right or wrong answer. It just really depends on the person and what they're comfortable with and what they've tried already. So initially, I'll say, the basic treatments would be home exercise and a general conditioning and strengthening program at home. If that's not going to work for them, then other options would be more formal physical therapy or osteopathic manipulation or things like that. More aggressively from there, I would say, is taking medication. And so there's a lot of different options, whether it's an anti-inflammatory or muscle relaxant or something for neuropathic pain, nerve pain. And then maybe even more aggressively from there would be injections or procedures for pain. And in that realm, there's a lot of different things that we can do to...
We're talking surgical procedures?
Even before surgery. Before surgery, there's a lot of different kinds of injections. There's something called a radiofrequency neurotomy, which is really good for pain that is in the back and not so much down the leg or in the groin or things like that. So more aggressively from there certainly is surgery. And ultimately that does become in some situations necessary, and it can be very effective when you get to that point.
My favorite thing you said was that you listen to patients. I think when people are dealing with chronic pain, trying to live that way, to hear a physician say, I hear you, I'm listening to you, that's a big part of it.
Yeah, certainly. And because pain is it's a hard thing to deal with for the patient and a lot of times for the physician and the provider. So a lot of times by the time they get to me, they've seen a lot of people, they've tried a lot of different things, and they maybe feel like they've been tossed around and they don't really have somebody that's listening to them. And that ultimately a lot of times becomes the trick for me, is hearing what they're saying and actually figuring out what's going on.
To learn more about treatment for your chronic low back pain, you may visit the Orthopaedic Associates of Muskegon website. We've put a link to it on ours. Go to 13onyourside.com.